friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, today we will going to discuss one of the very important topic in the pediatric clinical practice. So that is ataxia. So today onwards we will have some series of classes regarding approach to ataxia in children. What are the different aspects that they have to consider when we are getting a patient of or child of ataxia in the OPD level, and how you can proceed further, and after understanding the causes for the same, how we can employ the Ayurveda line of treatment for these children, and what are the important drugs which are used in Ayurveda for ataxia, and how well we can manage these cases, and what are the manageable cases. So all these details we will see in this particular class. Now first let us start with the approach to cerebellar disorders. Now before getting into the topic, we should understand what are the main function of the cerebellum. Now ataxia may be there because of many causes. Ataxia refers to incoordinated movements. Okay, when we are talking, there is no coordination. When we are walking, there is no coordination. When we are moving, there is no coordination. So this type of incoordinated movements, okay, so then it is called as ataxia. So now we have approach to this ataxia, because ataxia is basically may be caused by the many causes, but one of the main organ which is affected in case of ataxia, that is cerebellum. Of course, we will see other forms of the ataxia also. First of all, we will see the cerebellar ataxia or cerebral causes related to ataxia. Now, the main function of the cerebellum in the body is maintenance of the balance and also coordination of many movements of the body. So, if there is no cerebellum, suppose the movement can occur, but there is no coordination. Of course, movement is a function of motor cortex. So, there will be initiation of the movement, but that movement is finely tuned up, and that is a function of a cerebellum. Okay, so and it will be, suppose if there is no cerebellum, movement will be there, but it will not be graceful. It's not a graceful movement. So we know that our limbs are moving and our muscles are also moving while we are walking, dancing, running, and even our facial muscles are also moving. Tongue is also moving. Then when we are talking, so many muscles related to the oral cavity and tongue are also moving, but every time what is happening is cerebellum is tuning these movements to its best level. Okay, and if there is no cerebellum, this tuning will not be there, the fineness will not be there, and the movement become bizarre movements, and movements are not graceful. We may undershoot, we may overshoot. So there may not be any tone variation in the talking. While we are walking, there may not be a balance, and we are not able to maintain the balance when we are walking. So all these problems can occur if there is no cerebellum. If something is wrong in the cerebellum, how we will going to approach it? Now, in the eyes, we know that there will be nystagmus. Okay, so when we look at one side, we are not able to fix both the eyes at the same point, and there will be a continuous fluttering of the eyeballs and in the opposite direction, and this is called as gaze evoked nystagmus. So similar type of the movements, what we are talking, limb movements and muscle movement, so such movements are also present in the eye, because eye is also made up of so many muscles, isn't it? So in the eye, when the cerebellum is not functioning well, what is its effects on the eye? So there may be a gaze evoked nystagmus. Okay, so that means we are not able to fix both the eyes at the same point, and there will be a continuous fluttering of the eyeball. So this can also occur in case of problems related to cerebellum. Now another is head. Even the head nodding will be also there, because we know that head is also positioned in the midline or in the straight line because of the so many muscles. Now when the muscle movements are finely tuned by the cerebellum, and suppose if there is no cerebellum, even the head movement is also not fixed in the correct position, and there will be nodding of the head. Okay, so there will be nodding of the head, in Ayurveda we say Hatha Kandara, etc. Okay, so there is nodding of the head. So the head will be continuously moving forward and backward, or sometimes head may be moving horizontally also. Okay, so when continuously head is moving forward and backward, because the neck muscles are not finely tuned by the cerebellum, so then it is called as titubation. We know that it is titubation, head nodding or titubation. Now, speech. One more important thing is speech is also actually a muscular event actually. Okay, isn't it? This is also kind of movement only. Because of the muscular movement only, we are creating different types of the sounds and the speech, etc. And if there is any muscular movement problem is there, if these muscles are not finely tuned, because some of the problems of cerebellum, then speech will be also get affected. So this is also one of the important function of a cerebellum. So we will talk word by word, so which is made possible by the movement of the muscles, and also coordination is established by the cerebellum. So dysarthria, speech problem, slurring of the speech, or maybe stuttering, or maybe a hot potato like speech. So this type of speech problems may be also because of the problems related to cerebellum. Now we have to understand, see, I am discussing what are all the functions of cerebellum, and if there is a affliction of the cerebellum, then we will have all these problems. Therefore I am telling all these things. Now again, the grace of the talking is also gone. If there is no cerebellum, so we can not talk with the grace. That means there is no tone variation, there is no any fluency, or there is no any accent. Okay, so all these things have gone. Phonicity of the voice has been gone. Okay, so there will be a scanning speech or separate syllables. So when I say class, so class, so I will talk like this because separately I am talking each uttering each and every letter. Now another problem related to cerebellum is a prosody. Prosody, I think you may be knowing about it, which means that tone of the muscles. Okay, so we usually change our tone as for the situation, isn't it? So when I am sitting, I will have a different tone of the muscle. When I am standing, I have a different tone of the muscles. When I am sleeping, this different tone of the muscles. Similarly, when I am talking also, the tone of the facial muscles and oral cavity muscles, so that is different. Okay, so when this particular tone has gone, so then it leads to staccato speech, staccato speech, or hot potato like speech. Okay, so what actually happens is volume of the speech suddenly increase and suddenly decrease. Suppose I know that I am going to office. This is what usually I will say. But if I have got this particular staccato speech, then I am going to office like this. So sometimes suddenly some of the words are told with a higher pitch and with the lower tone like that. Okay, this can I am going to office, this is normal. I am going to office, so this is now something abnormal. So this is called as staccato speech. Okay, so there is no smooth mode. Why this is happening? Because of the modulation or fine tuning which is done by the cerebellum. Whenever any movement is taking place, that is not done, because it is also a movement, isn't it? When I am talking, it is also the muscular movement. It has to be finely tuned, but it is not happening, and therefore it leads to this type of speech also. Again, the problem is there in the cerebellum. Now in the limbs, we know that in the limbs we will have the intention tremor. When there is some problem in the cerebellum, of course intention tremors may be there in some of the other problems also, dopamine related problems, so that we will see in the other class. But here even the cerebellum problem also may lead to intention tremor, that is in the limbs. So in the speech we have seen, in the face we have seen, in the head we have seen. Okay, so now we are coming to the limbs. In the limbs it will have an intention tremor. Now suppose if you want to pick up a cup of coffee is there kept in the table, and you want to pick it up, and now your brain calculates the distance between your hand as well as the cup where it is kept on the table. Then only, so it decides how much force I have to put, how much muscular movement has to be done, and what should be the speed and velocity. So everything will be calculated in the brain. Accordingly the movement will take place. Okay, so now as we are moving continuously, we have to change the angle and force and position every second. Suppose when you are talking, how much balance we have to maintain, because every step we have to change the position, change the angle, change the force, etc. See how dramatically and fantastically it is carried out by the brain. Okay, so when we are closer to the target, suppose I am picking a cup of coffee, so when I begin, I will begin with the more force, but when I just about to reach that particular cup of tea, so then I will reduce the force and I will go by smooth movements. Okay, so now So when we are closer to the target, the amount of the calculation required is again more, because fine movement. So suppose tea is kept here, coffee is kept here. When I start my movement, it goes little fastly, but when I approach as near to the cup, then I have to go slowly and I have to go very finely, because I have to now catch the I have to pick up the cup. So now there is more requirement of a calculation is there. So now in such time, it is the cerebellum which always provide the real-time data to the cerebrum to act accordingly. Of course, movement is initiated by the cerebrum, and it is the cerebellum which is continuously giving the real-time data to the cerebrum. So how you have to change, how you have to calculate, how much force required, how much tuning is required, everything is given by the cerebellum. So when there is a cerebellum problem, then there will be overshooting or sometimes undershooting. Okay, this is usually one of the cerebellar sign, overshooting, or there may be undershooting, and there will be correction. So which leads to the intention tremors, and this is called as dysmetria. This is also intention tremors are also called as dysmetria. Either there is a overshooting and overshooting and correction, overshooting and correction, overshooting and correction. So when this is happening, that leads to intention tremors like this. Overshooting and correction, overshooting and correction. Okay, so this is also called as dysmetria. So this is one of the cerebellar problem. Now there is another important problem related to cerebellum, that is dysdiadokinesia. Dysdiadokinesia. So this is when this is a situation where we cannot do the rapid alternating movement. So just when we are preparing the chapati or roti and all, so we know that how the flour will be. After preparing the roti, we will do like this, isn't it? So this repeated alternating movement, so that is not possible. Okay, so in the OPD also you can check the patient by telling this repeated alternate movement like this. Okay, like this, or you can do like this. Okay, these movements, so when it is not possible, it is called as dysdiadokinesia. Okay, so this is when we cannot, or patient cannot do the rapid alternative movements. Okay, so this is called dysdiadokinesia. This dysdiadokinesia is also one of the sign of a cerebellar problem. Now dyssynergia, there is another problem, that is dyssynergia. So if you want to lift a cup, your digits should be used, isn't it? Suppose cup of coffee is there in the table, and if you want to lift it, your digits should be used. But the arm contains many joints like shoulder joint, wrist joint, elbow joint, and interphalangeal joints, etc. So all these joints, in order to lift the cup of the coffee from the table, all your joints should be in coordination with each other. Okay, isn't it? If my shoulder is above, I cannot lift it. Shoulder should come like this. The elbow joint should go like this. Okay, wrist joint should do like this. So when this particular synergia or coordination is there, then only that particular digits can go and pick up the cup of coffee. So all these maintain a position to lift the cup, one after the other in a very smooth way. This is never identified by. We never feel that all these things are happening, but automatically it is happening because it is carried out in such a smooth way, and this is called a synergia. This is called a synergia. So when cerebellum is affected, problematic, the problem is there in the cerebellum, again you will have problem in synergia. So if the cerebellum is affected, sometimes elbow can move first, and wrist and the shoulder joints can come later. It should not. First the shoulder should come, then the wrist comes, then so it should go in a order. Or sometimes the opposite can occur if the cerebellum is get affected. This is another important problem. So synergia, okay, dyssynergia. Synergia will not be there, and that leads to dyssynergia, and this is called also one of the cerebellar problem. So sequence is lost, and also the flow is also lost, and this is called as dyssynergia.